to another episode of the Wicked Awesome Podcast. I am Claudia Jordan, and I'm joined by the beautiful
Shanna Mogler.
Yes, we are pageant girls with filthy mouths.
East Coast.
Yeah.
And we're wicked awesome.
Wicked Awesome. And people say, why is the podcast called Wicked Awesome? That is such a popular term, a thing to say in Rhode Island.
You know, and people were asking me too, Claudia, they were like, how did you two even connect? I don't think people really realize that we actually were born and raised in Rhode Island, that we knew each other through pageantry, we knew each other in Hollywood, and we're, long time.
Back to the 1900s,
right.
I say. The 1900s is when I first laid eyes on this beauty, and she's not aged at all. You have not.
You know why? I'll take that compliment. I have, but I haven't aged because I went to Dr. Ben Talei, and I'm super excited today because we actually have Dr. Ben Talei on the show.
Oh my God.
He is a world-renowned surgeon. He's the founder of Cupid Lips in Beverly Hills, in Los Angeles, on Sunset. He's also the creator of the Aura Lift, which I actually had done.
What is that?
Oh my God, we're going to talk all about it. But he's actually here today. I'm so excited to have him because, you know, you and I were talking on our beauty podcast that we did about, you know, aging in Hollywood and the pressures of aging in Hollywood and what that means. And so I think it's going to be great to have him here to talk to women and kind of tell women the difference between Botox and filler and what's trending and what.
It's crazy how many people think that Botox is filler.
Yeah.
Or filler is Botox. They're like, oh, look at her. She has all that filler, Botox in her face. I'm like, you don't know she has Botox in her face.
Right.
You see filler.
Yeah.
They don't know the difference, and I just find that this is our duty to educate the masses with Dr. Ben.
Well, we're bringing in the professionals.
Yes.
Okay, so we're super, super excited to introduce Dr. Ben Talei. He is here with us. Hey, Dr. Ben, are you there?
Yes, ma'am. Here, staring at your beautiful face.
Oh, well, it's only beautiful because of you. I'm grateful.
If you've done this work on her where she looks so natural, I need to come see you immediately because the way these jowls are trying to kick in,
She's
and this
crazy.
line on my cheek is like kicking my butt. Overhead lighting is not my friend, and I need to see you.
You are crazy.
No.
But
Well, what's funny is I need Shayna to remind me that I've done anything on her every time I see her. She's like, remember when we did my lip? I'm like, no.
Yeah.
She's like, remember when we did my face? Because she doesn't look any different than when I met her, back 11 years ago. She looks like the same adorable little Shayna.
I'm fighting the good fight.
No, you look good, and you definitely you don't look like you've had anything done.
Well, this is the thing. Dr. Ben Talei is one of the leading facial plastic surgeons. He does everything. He teaches all over the world. I'm going to brag about you a little bit.
Please do.
But one of the reasons why I went to Dr. Ben Talei is because I definitely wanted to have a lift. That's all I've done. I did the Aura lift. And Dr. Ben, you can kind of explain more about what that is. But I honestly feel it was like the best thing I ever did in my life. So why don't you tell us, Dr. B, what is an Aura lift? How did you come up with it?
Yeah, the Aura lift is it's kind of my unique way or take on doing a face and neck lift, which is a bit different than the kind of classic type you'd see running around Malibu in LA and not looking so great. And in the world of facelifts and neck lifts, we have they kind of classify into deep plane, not deep plane, mass application, whatever it is. This kind of falls into its own category where I really, my goal is not just to lift someone and stretch out their skin and do all that kind of weird stuff that people used to do. My goal is analyze somebody, find out where their face came from, look at how their face used to function, all the stuff that we're treating with Botox, and then find a way with surgery, with this lift, to put it all back where it was, which sounds simple enough, but it's by using entirely different techniques than other people use. And that's why when you look at you or, other kind of before and afters, it's this dramatic change that ages really, really well, but then nobody can tell in person that it was done. And it's to the point where even I can make people look happier at rest when they're not smiling. And then when they do smile, it looks so much softer. So it's something that you don't get with other facelifts, is I can actually make every single photo you take look kind of softer and better by modulating and moving around the muscles to get them to function better. So it's a really
Wow.
cool type of lift, and really improves people's like skin quality.
And who's
skin
like
tone.
someone you think is like a good candidate for that? Is there a certain age group? Is it like when should a woman even maybe start thinking about this might be something good for her?
Yeah, so for the classic kind of aging type, I'd say most people are around like 45 to 55. And then I have a special version of it that I used to call the weekend lift, but it's called the internal deep plane neck lift or internal deep neck lift. And what I do there is for patients in their 20s and 30s who have always had a bad neck. I can actually make these minimal access incisions that you don't see, and I can get a massive, massive neck lift out of it from that too for those younger patients. But the aging ones, it's usually like 45 to 55, something like that. It's no longer like a skin surgery. It's an everything facial rejuvenation.
What kind of downtime are you looking at for this aura lift?
The aura lift is like, it takes 2 to 3 hours to do just the lift. If I do the eyes and everything else, it takes longer. But typically at about 3 weeks, you look, I call it disguisable, where you wear some makeup, your hair down, you go out and about and people don't notice.
Mm-hmm.
But then if you're an actor, you're a singer and you're performing on stage or filming, it's really 3 months to be camera perfect, video perfect, event ready. So much that like if you had a twin sister, your twin wouldn't know you did anything.
Wow. Okay, so we wanted to ask you, for instance, we were talking earlier about filler and Botox. Can you tell our audience what is the difference between filler and Botox?
Yeah, so a lot of people get confused because they say like I had Botox here, filler there, filler there. I'm like, do you mean Botox? Do you mean filler? So they don't know the difference. So Botox it's a type of medicine that we get from a bacteria, and we inject it into the muscles to relax the muscles. So you can kind of modulate those wrinkles and the little 11s that you get between the eyebrows and the crow's feet. And you can even lift the nasal tip a little bit, things like that. So it's more of a muscle modulator, and it works by paralyzing or paresing, meaning like weakening muscle. Filler is an actual gel, so it's a volumizer. So you're adding this gel into the face, which also is made through a bacterial process, and that adds volume and helps lines by filling them, not by relaxing them. And you can use them together and use them separately, and they're both fantastic unless they're used incorrectly, which is, again, all those Malibu faces you see that they don't look so great when people put
What
too
do you
much
think
and they
is
put it in
like
the
the
wrong
best
place.
brand of filler?
There's no best brand. The stuff I don't use are the ones that cause problems. So there's ones that have calcium in it. I don't use those to volumize the face because it can just cause more issues and it's a little bit higher risk. So I use the gel fillers, which we call them hyaluronic acid fillers. And my favorite for the lips, for example, is Restylane Kiss, which is like wonderful. And then Allergan has a couple good products for the lips as well. But there's no single best filler overall. It's just more how you use them, because most doctors don't know the difference between them and don't use them very well.
What's the filler that has calcium in it?
What is that?
What's the filler that has calcium in it?
The main brand that has calcium in it is called Radiesse, and it's a great product for when people are like injecting on the bone and things like that, which is great. And then they have other ways of doing it where they try to stimulate, under the skin to form a little bit of a biomatrix. But I personally try not to use it in the face just because I don't like it when it stiffens up the tissues.
Okay, so I was on TikTok, and I saw these nurses showing where they would inject Botox, to lift the brow and everything. And I just thought it was like if it's one thing if you're a nurse and you're like wanting to watch these TikToks, but so I made a TikTok and I was like, why are all these women like making these TikToks showing where you inject Botox? I was like, who's at home injecting Botox into their face? And I got like yelled at. There was like thousands of women who went to that and they were like, hey, I'm not rich, I can't afford Botox. So these women are buying
I'm
Botox.
not rich, I'm just crazy.
Yeah,
What?
thank you. They're buying Botox. No, I still have it on my TikTok. You can go to it and read it, and you can read all the comments. And they were like, I get all my Botox from Korea. I do it all myself. I save myself thousands of dollars.
What?
Dr. Ben, what do you,
Hell no.
I feel like, can't you, go blind? Isn't it really dangerous to do this?
It's partially dangerous, partially stupid in terms of aesthetics. So the dangerous part is botulinum toxin is a bacterial toxin that causes botulism. So it's the one where you get great baby syndrome, and the baby wakes up paralyzed and has to be on a respirator and that kind of stuff. So
Oh, gosh.
the dangerous part is partially that. So let's say you even buy the best product in the world, you don't know what you're doing, and you inject it into a vein, you can die from that.
Oh, wow.
And that's from just it circulating in your system, going to your lungs or your heart. The other problem is if you're able to buy it online, you're most likely not. You have a good chance of not actually injecting Botox. It's like when people, buy different drugs and they think it's cocaine, and it turns out to be fentanyl, because nobody's really checking with the drug dealer if it's
Yeah.
good stuff. So that's the problem with, buying Botox online and injecting yourself. Those two are the big risks. Now, the aesthetic problem is that you probably also suck at injecting it. And when you inject in the wrong place, you can get droopy eyelids, droopy brow, you can paralyze around your mouth where you just sound idiotic. It's not a good chance that you're going to get a good outcome. You're likely going to get a bad outcome from it.
So,
Injecting
ladies.
filler to yourself is the ultimate stupidity. So
Okay.
injecting filler, and this has happened many times.
I
people
just watched a
blind
girl on
themselves.
TikTok who had her boyfriend injecting Skin Vive by Juvederm into her face.
What?
Yeah, not a good idea. So you can blind people permanently, and you can kill the skin on their face, and that's not like a scare tactic where you just tell people that so they don't do it. It is real world. So it has happened. You can look it up online. There's plenty of reports. Person injects herself, goes blind. Person injects herself, kills her nose. Person injects herself, kills the chin on her skin, and has to get a free flap surgery for it. So you can inject those gel fillers into vessels, and you are screwed, and you're screwed permanently. So there's no fixing that.
But Botox, I will say, when used properly, and I would never inject myself with none of this stuff. I
Yeah.
would definitely seek a professional. It's like if you can't go to a professional, just don't do it. Go without or save up until you have enough money to get it done, I would think. As far as opening the eye, because that's also something I was thinking about. I'm starting to get a hooded eye, the skin of my eyelids are getting so droopy. I feel heaviness. I feel like it's getting to the point where I feel like it's affecting my vision. It's hard to keep my eyes open sometimes.
Wow, okay.
So I know you can do Botox to open up your eyes a little bit, right? Can you?
Yeah. So on you specifically, where you inject it is you avoid injecting your forehead. So injecting your forehead makes you heavier. If you want to brighten it, it's right under your lateral eyebrow. So right below your eyebrow on the side, you inject it, and it relaxes the muscles that pull down your eyebrow, and your eyebrow springs back up. And the cool thing on you is that when you smile, your lateral brow comes down a little bit. So this
She's
will
injecting
keep that from
herself right
happening.
here now.
I'm practicing.
Yeah.
She's doing her eye with her fingernail.
Yeah.
Can I go to
But
my
on you, if you do
doctor?
that, you'll see that when you smile, it looks even better.
Could I go to my doctor and say, my general doctor, and say, hey, I can barely keep my eyes open right now. I feel like I need doctor-approved cosmetic surgery, and my insurance pays for it because I feel like my eyes are so heavy. It's affecting me when I drive. I feel like I can barely keep my eyes open. Will they buy that?
Well, so insurance actually does cover when you have hooded eyelids, or if you have
there you go.
ptosis, which is drowsiness in the eyelid and it affects your vision.
I feel so sleepy. My eyes feel
doctors-
so heavy all the time. And this happened in the past year, where I'm it just got double the skin up there.
Yeah, so in that case, we just do your upper eyelids, easy peasy. That's kind of like removing a mole. It's not a real big surgery.
Oh, the upper blef. Is it the blef? Is that what it's called?
Upper blef, exactly. Upper blef, that's where you
fancy
remove
with
some of the
We
eyelid.
know the terms.
What's the recovery time on that?
But I just wanted to say this real quickly. So, ladies, And gents out there, please stop injecting yourself with Botox and filler because
Please.
it terrifies me. But go on.
It's terrifying.
Continue.
It terrifies me, and I'm not scared of many things. So, yeah, but the downtime for an upper bleph it's about like a week. So it's one of the stuff that you go back to life quickly. It does take 3 months to be perfect, but it's about a week. The problem with the upper bleph is most doctors think it's something where you just remove skin and boom, you look younger. And as you guys saw with like Bradley Cooper,
Yes, he looks so
Renee
different.
Zellweger, it's not the case. So it's a little more complex than that. Sometimes you have to add volume. Sometimes you have to change the shape of the incision.
Can I ask
There's
you?
a lot of things that you have to do. Yeah.
Can I ask you a question since we're kind of touching base on some celebrities out there, who, and is that what you think Bradley Cooper did? Is that what's going on there? Is that an upper bleph?
That's my guess is this is totally a guess, is he may have done the upper lid and could have done the face with either filler or fat grafting, and at the same time could have lost some weight, which exaggerated everything. So that's my guess.
So
I'm not sure.
wanted to ask your opinion. What do you think is going on with Brandi Glanville? Because I know that she's saying that she has like a parasite or something, but I personally feel like she either has an infection from filler and things like that, or maybe from the removal. What, in your professional opinion? I know she's not like a, what do you think?
So I don't know. It does not look like it's a standard thing. So it does sound like what you're saying.
Oh, wow.
So
Okay.
it's not like when you have standard infection, standard type of filler dissolving issues, it's usually unilateral, meaning one-sided, not the whole face unless it's an atypical mycobacteria. When your immune system is involved and other weird things happen, you get these diffuse kind of changes. So most likely it's what she is saying.
Wow.
I don't know for sure, but most likely it is. It's a very strange phenomenon. So it's in that case, even if she had a lot of fillers or not before, that's not really the cause of it. It's not like anything she did. That's just like really unfortunate, really bad luck.
I thought it was Ozempic face because I realized that's when I started getting that deep line in my face. What about, can you speak on Ozempic face? I actually had an issue like when I first did it. I also had 2 surgeries that same month. I had a dental implant put in and surgery on my toes. So I had to go through 2 rounds of antibiotics in 1 month. And then that with old filler and then Ozempic. I don't know what happened, but I had some weird reaction. My cheekbones got, where the filler was, my cheeks got super huge. And I feel like I've been deformed ever since. I feel like this isn't regular aging that I have. I have pictures from like November 15th and then 1 week later where my face had changed and I've been trying to get it back since. So, Ozempic,
So
what about?
Ozempic face is a strange phenomenon that it's not just weight loss, what you're seeing in the face. It's just weight loss, people have in the face, and it doesn't look as dramatic. Like, so people who get this, what they call Ozempic face, they look like they're malnourished crackheads. And that's like this severe kind of way of explaining it. But the face becomes very gaunt, very dehydrated, and even the way you talk changes because the muscle function is changing so rapidly. So you're getting a change in muscle function, either from the muscles thinning or from loss of fat on the muscles, which changes how they function. You get a downregulation of all the kind of protein turnover in your face because of the GLP. And on top of that, you're getting really rapid hormonal changes. So I don't know if you guys know this, but most of your estrogen turnover is happening peripherally in your fat cells in your body. And if somebody, let's say, becomes anorexic and they don't eat, they get something called early menopause or pseudomenopause, where even though they're young, their body feels like it's going through menopause because their estrogen drops and you don't have any turnover and it feels like menopause. So same kind of phenomenon can happen with rapid weight loss with Ozempic if you don't have good fat stores left. So that's why we tell everybody, really go slow with it and don't take it unless you need to take it. It's a beautiful drug for those who need it, and it's a beautiful behavioral modifier. It can calm down compulsions and compulsions of eating, compulsions of gambling even in some cases. But when
Guilty
you're
on
someone who's
both.
relatively skinny and you take it, it only causes problems.
So it helps you with your gambling? Because I am a gambling
people
addict
will-
and snack addict. Dark chocolate.
Yeah, so some people who have compulsive behavior, just like eating, it's been known to calm it down.
I have not been gambling much this past year. And I was ridiculous. When I say gamble like the
I
big
know.
boys.
She was supposed to judge for me at Miss California, and I lost her to Vegas, and I was like, "You need to get out of Vegas and get to this pageant to judge it immediately."
What happened was,
But okay, wait. But we will get into that. But I want to get into lasers and tech. So lasers is another big thing that a lot of women are asking me about. So I wanted to know if Dr. B, you could kind of tell us what are some of the different lasers out there, and what are some of the new trending kind of hot and new lasers out there for women? Like, what lasers do you think actually work, and which ones are kind of outdated and don't waste your money?
Okay, well, so in the heat-based therapy world, you have lasers and radio frequency, and in some cases you have ultrasound. The way these things work, lasers work by shooting photons of light. So the way you're depositing energy into the skin is by shooting these photons of light in the skin. The radio frequency, what it does is it takes the energy or the electricity out of the wall, modifies it into something your body can tolerate, and then injects it into your body. Right, into your skin. So the way that they work is you're damaging your skin in an effort to get it to remodel, to bring your immune system in and say, hey, fix this damaged area, and you're kind of increasing now the cell turnover and all that. So that's how they work. Understanding that, you generally don't do lasers unless you have damage from age or damage from something. You don't just do lasers to be healthy. It's not how it works.
Oh, okay.
And if anything, if you're doing it at a young age, it can accelerate your aging because you are torturing your skin and you are at some point possibly melting some fat or causing inflammation. So you have to be cautious and know when to do it. And the other thing is, as far as new technologies go, so this is basic physics, right? This is light particles that we're shooting into the skin. Not much has changed in our knowledge of that physics over the past 20 years. So new machines, when they come out, are really only beneficial when they're making some modifications to decrease downtime or recovery or that kind of stuff, because they found a better way to deposit the energy without burning you as much. So most of the new ones that come out, they're not beneficial because they're new. They're not groundbreaking, not mind-blowing, but they do sometimes have better recovery and things like that. But my advice to young people in their 20s is, unless you really have a problem, you're psychotic for doing, let's say you have acne. Okay, you've got damaged skin. It's okay to cause some damage to make it better. If you've got healthy skin and you're young, you really just need to protect it. There's not much you can do to make it better, only worse. And most people don't get that. And now you have this whole world of girls, especially, whose aging has accelerated tremendously. And when they're, 30 or 25 years old, they look like they're 45.
I've been amazed at how young girls are considering getting like neck, facelifts and Botox and all these things when I'm like, you're 28. What are you doing? Like, do you need that?
Yeah, you need to calm down.
Right. I think everyone's trying to look like a filter.
What the hell did Lindsay Lohan do, though? Because she looks pretty fabulous.
She does.
What did she do?
So she most likely, the definitive, like the thing it seems like for sure is she dissolved some fillers and then maybe did some fat grafting with it. Maybe did a small lift with it. It's hard to say. But yeah, she's looking great. This is kind of the era of facelift, and it was popping off kind of last year, 2 years ago, and then this year with Christina Aguilera, with Lindsay Lohan, with Brad Pitt, and then eventually with Kris Jenner, who more public about it. It really became the era of facelift. And
Demi Moore looks good.
Yeah, Demi Moore looks great too.
Yeah. So Demi had probably a lip lift and a facelift.
So I'm gonna ask you.
A lot better.
Dr. B, I'm going to ask you about some lasers, like about 3 or 4, and then you tell me if you think they are like worth doing or not. Like, so a big one that older women or women are doing is the CO2, which for women out there, it's almost like I mean, you can explain it better, but that's like a 10-day downtime. It's almost like a peel.
It hurts, right?
It's very painful. Yes.
Yeah, so
You've heard.
there's different energy levels you can use on it that would make it either more downtime or less downtime. So it's not the laser necessarily, it's the energy level. And it's one of the best ones to use if you have scars, for resurfacing. And it's great to use if you're somebody who has wrinkles and pigment and you're treating your pigment, but you want to kind of just resurface everything. So CO2 goes fairly deep in the skin, meaning it can improve kind of fine lines and wrinkles nicely, not just do pigmentation stuff.
Okay, what about Metamorphosis 5? Like, everyone loves that.
I haven't heard of that.
I haven't heard about that.
Or not
one.
Metamorphosis, Morpheus. Sorry.
Yeah, so Morpheus is a radio frequency, and the best 2 radio frequencies that are kind of multi-modular and you can use them pretty versatile are going to be Morpheus and Matrix. Matrix is the one by Candela, and then Morpheus was by InMode. And those are awesome because what you're using them for is you're putting needles in the skin and passing electricity through them to kind of shake up the proteins. And you can get nice improvements in superficial skin quality. Now, there is a big kind of watch out here is that with Morpheus, because you have the ability to go deep, some practitioners do go deep in the wrong places and they melt the fat in the face. Oh. And then again, you look older than you would have, right? We're losing fat as we age. You don't want to accelerate that or lose more. So that's the problem, is when people don't use it correctly. Otherwise, when you use it correctly, Morpheus and more so even Matrix are great things to do. Matrix is my favorite of them.
Wow.
But these are not maintenance treatments. So that's something that people also get wrong. You use these to improve, maybe fix something, and then move on with your life. You don't keep doing these every 6 months. So Morpheus or Matrix, you may do it 3 sessions to get the max improvement out of it. But once you plateau, you stop. Because if you keep doing it, you're going to eventually cause deflation and more inflammation and other problems in your skin. So it's these lasers, the way to look at it is you use it to fix something, improve something that's damaged, and then move on. You don't keep doing it. The stuff you want to do for maintenance is going to be like PRP microneedling. That hydrates your skin and keeps it hydrated probably for about like 3-4 months.
Oh.
You can use Definage. You can use creams that have retinoin in it. You can use all these things for maintenance. However, doing lasers over and over again is not a smart way to approach maintenance.
So maybe
like
we go through like the age groups. Like, what should what should women be doing in their 20s? Yeah. What should women be doing in their 30s, 40s? Like, give us your best tips for the 20-year-old.
Yeah, so best tip for 20-year-old, don't do much. Have some nice moisturizers. When you keep your skin moist, it's more protected. Whether or not it has sunblock in it, it's still more protected than if your skin is dry.
Are you a sunblock
so that's
guy? Like
me, I mean, sunblock is good. And if you're so let's say you're like the white girl on this show, you got to use some sunblock. Right? Let's say
not
you're like
me. I mean, I just fry.
I think that's you.
Even talking about the sun, I like fries.
I've used sunblock probably 3 times my whole life. Okay, on my shoulders in Aruba. That's it.
Oh my God, I will fry.
Yeah, but that's the way to think about it is look at your skin type, look how it's going to react to the sun. We need sun, right? We need sun to form vitamin D. We need sun to survive. You want to be healthy, you have to have some sun exposure. It's ridiculous to say hide from the sun. Right, because we have people who think that way. They think hide from the sun at all costs, but you're losing something. You remember in like COVID when they told people like don't go out of your house, don't do this, don't do that, but then a bunch of other shit started going wrong. So it's really the same thing. Is yes, sun can cause damage. Yes, it hurts some people more than others, but not having sun can also cause problems. So you have to look at your skin type and just be realistic about it. So again, let's say you're like the white girl on the show. So you're probably gonna have to use more sunblock. And it's gonna protect your skin long term, especially from early aging if you're somebody who tends to spend a ton of time in the sun. If you don't, then it's not a big deal. Now let's say you're like the darker one. You probably don't need so much sunblock. You can probably survive just off of like really good moisturizing, things like that. But either way, for the for the 20-year-olds, it's, they have all these TikToks where like, this is my skin regimen. It's like a fucking toddler trying to talk about her skin regimen as she protects her toddler skin, which is like ridiculous. So
I think all 20-year-olds and even teenagers and boys too, I feel like they should all have a good cleanser, a good wash, a good toner, maybe a scrub like once or twice a week, like and then just a really great moisturizer.
Moisturizer is my number. If I'm on a desert island and you ask me the one thing I need, it has to be moisturizer.
Yeah.
Every time I take my makeup off, I got to put moisturizer on, or it just feels like I'm gonna crack.
But I feel like girls and teens and 20s, they should have a skincare routine, but it should consist of like 3 or 4 steps.
I've never used toner.
So so that's what I was
Takes
going to
the
say.
dirt out of your
1 to
pores.
2.
Oh, maybe
so
I
you
need
want
that
to.
then.
You really want to keep it as like simple as possible and tamper with your skin as needed. So there's some people like me, for example, where if I use a cleanser, if I use anything other than just showering, I start to break out. And if I don't, my skin remains perfect. So there's a flora on the skin and a balance that your skin has that you have to kind of learn and respect. So there's no like secret for everybody. You have to kind of learn on your skin what's going to calm it down more.
Yeah, that
some
makes
people
sense.
go and they use too many things and then they start to develop acne because they created a flora imbalance. When people take too many antibiotics and they have GI issues forever. So the same thing happens with your skin. So you really want to find something that will keep your skin moisturized, keep it kind of healthy, keep it hydrated, but at the same time respect its balance. And that's a really important thing to find. And not everybody can find it, but that's the goal. So for young girls, as few steps as possible is always better. Now you get into your 30s.
Yeah, what do we do for our 30 ladies?
Well, it depends. If you're a white girl, it's different, right? So if
God,
you're a white girl in your 30s.
You're Irish.
Hey, listen,
skin.
can we get one thing in this world, Shayna?
Yeah.
My mom.
One thing we got.
My mom was dark and Portuguese and beautiful, and I got my dad's shitty Irish skin, and I'm freckly, and it's not cool, and I'm not alright with this. Anyway, let's go into our shitty 30s and shitty white skin.
That's shitty white skin.
So there's so let's say it's the thicker white skin, don't need to do much. The thinner white skin, which is that light white Irish, that
right?
forms more
Light white Irish.
Yeah. So that the thinner types, now you're using some retinoid maybe one time every 4 days.
Well,
So once
I
every
wasn't
4
doing
days.
that in my 30s. I sure wish I was doing that.
Yeah, but not a big deal. Or you could use Definage. Definage is a different one that's a little more
what is this
gentle and benign.
prescription cream that all the kids are using these days? It's like called it starts with a T. It's like trazanatone or something, or it's a prescription cream that's supposed to help.
I've never heard of it.
It might be tretinoin.
Yeah, I think that's what it is. Yes. Yeah. What is?
Yeah. So you probably don't want to use it that young if they're really young.
Okay.
Because what
my
it'll
old
do
ass.
because so what these vitamin A compounds do, retinoin, tretinoin, all those, what they do is they increase the skin turnover. So your skin is always kind of like sloughing off at any given time. But what that does, remember how I said moisture protects you?
Yeah.
This does the opposite. It demoisturizes you because you have no protective barrier. So you have to really keep your skin moist at all times, and you're more prone to chronic sun damage because of that.
So let me ask you this:
not,
should women start, like, if they want to do Botox, should they start in their 30s? Obviously, I know it's a case to case. It's a personal thing. I know it's a personal journey. You got to learn your own skin type, all that kind of stuff. But I get asked that question a lot. Like, when should I start Botox? Or
you do it as needed. So there's no magic time. most people, yes, it's kind of in their early 30s. Seems to work out for them.
Is there such thing
There's
as
no point
preventative Botox?
Yes, yes. For most people who think they're doing it preventatively, they're not. But there are people that you see that are super thin skin and they're hypermimetic, meaning they have really strong muscle movement and they have thin skin. Those people, once they dig in a line into their skin, it's there permanently. So it gets etched in. So you can actually treat those with Botox a little earlier in life, and you will prevent it. The other is, or at least you slow it down. The other is people have behavioral issues. So some people tend to kind of pull down on the side of their mouths when they talk a ton. And then as they get older, they get this permanent...
I thought you were going to say, like, drink tequila and vodka and the age.
Yeah, you don't be happy.
That's just me.
So they get a permanent resting bitch face, that big kind of frown line on the side of their mouth.
Yeah.
And so on those people, you can also Botox them a little earlier, or you can actually train them. So you can do, people don't know this, you can actually train yourself now this is a lot of work, but you can train yourself not to make these movements by making the opposite of those movements. So let's say the frown is digging in. So you train yourself to smile to break it. And eventually your resting tone goes upwards instead of downwards. So you can actually do that kind of stuff if you spend a lot of energy on it. But you don't want to do it all the time where you walk around and people think you're like a psycho.
Okay, wait. So what is the best advice for skincare we're giving the 30-year-old group?
30-year-old is if you're that really thin, light skin and it's starting to have lots of pores and this and that, then let's say mid-30s, consider a retinoid. Mid-30s to late 30s.
And
really not
4
sooner
days,
than that. Because then the downsides of doing it earlier are you dried your skin out from an early age. So, I wouldn't do that.
Okay.
So still in your early 30s, you're dealing with moisturizers and serums. Like vitamin C serum, people love that. And it's not like a glycolic acid, but it is slightly acidic. So like vitamin C serums are awesome. Glycolics are pretty awesome. And you're avoiding the skin damage that you'd be getting with retinoids. So early 30s, you're sticking to that. Late 30s, early 40s, now you're really getting into the retinoids and Definage and that kind of stuff.
Mm-hmm. All right, well, let's get into our mid-40s, early 50s. What are we doing with our ladies there?
So now you're worried about volume loss. Yeah. You're doing your Botox. You could do very small dots of filler. But now you're worried about volume loss. Again, the thinner skin type is more affected. So yeah, at that point, if you're getting the wrinkles, you can use these retinoids. That's what it's for. You don't use retinoids as prevention. You use it for wrinkles that have already kind of formed and, you're at that point in your life. Mm-hmm. And then you say, okay, I need some volume. And eventually you say, I might need a lift. So remember we did the Profound years ago?
Yes, that was fun.
So that's a great option. Let's say someone's kind of deflating. They're getting a little lax, not ready for a lift, nor do they need a lift. What you do is you add a little volume to the face with some fat grafting or microfat, nanofat, little gentle stuff. And then you lift them or tighten them at the same time. So you could do radio frequency with either Matrix, Morpheus, or Profound is the one that we did, which is the strongest one.
I look like
although
a pumpkin head.
they decided to not offer that machine anymore.
Super swollen?
Yeah, when they first do, the Profounds where I had like a pumpkin head, right?
Yeah. It was adorable.
Not an adorable pumpkin.
No, you can literally Google me. I look like the cat lady. Like my eyes, I mean, it was phenomenal results. I do have to say that. But, and the downtime really wasn't that bad. And I think you did a CO2 on top of that Profound. So that was a little.
We did both.
Yeah, we did both. But yeah, that was pretty good. I've done everything, Claudia. I mean, I have done everything.
I'm sitting here trying to keep my eyes open because my lids just feel so heavy. I'm about to book a flight to LA and go see him.
No, he's like, and this is the thing too that I think is very important that a lot of women do. Like, please don't like fly to Turkey and just go to Mexico because you can get it cheaper.
Yeah.
I think it's so important that if you're going to do like something to your face, especially, I mean, anywhere, and breast implants, any lipo, anything, women are injecting, like cement and terrible
It's
things into their
insane.
bodies. So I think I can't stress, for me personally enough, finding a qualified, board certified. Dr. Ben teaches all over the world. He teaches his technique. He trains surgeons. Really finding someone who's experienced in what it is that they're doing and looking at their work. Seeing their befores and after, and And
Did you do the eyelid?
I did. He did.
Because your eyes look so bright and open and like round and almondy, and mine's just look. I'm getting a hooded eye like a man.
I did. You do not.
I have a manly hooded eye.
You do not.
Yes. Look at the hooded eye.
Dr. Ben did a lip lift on me too, where they go under the nose. So, but I mean, and you did such a great job, Dr. B. I mean, no one can ever even see that I have like a little scar under my nose.
No, good.
I did the whole shebang. I did the neck, just the lift, the whole lift. It was magical.
It sucks when you look in the mirror and you're like, oh my God, like I used to, like, I didn't need to do this or I didn't need to do that. And I'm just like, maybe took it for granted or whatever. I just feel like sometimes I look in the mirror, I just don't recognize. I'm like, this.
Oh, Claudia.
It's not
Oh, my
face.
God.
This line and this neck is really, I have a complex over it.
Well,
and the eyelids.
we did a show about aging in Hollywood and aging gracefully in Hollywood and talking about that. And obviously, we're not going to look like who we were in our 20s or in our 30s. I think having realistic, beauty goals. But Claudia, you look absolutely, and I'm not saying this just because I'm your friend or anything. I mean,
thank you.
You look incredible. Women would die to have your skin and look like you.
And I don't want to look like 10, 20 years ago. I want to look like what I looked like 3 years ago before the whole fiasco happened.
Yeah.
You know what I mean? Like, I just want that. So I don't feel like this, what I have here is because of regular aging.
Sure.
I feel like
Did I miss the fiasco? Did I need to Google this? What's the fiasco?
I mentioned earlier where there was 1 month where I had filler that was perfectly placed. I loved how my face looked. It was like second week of November, 2022. And then I had surgery on my toes and a dental implant. So I was put on 2 rounds of antibiotics in the same month. And then I started Ozempic that month. I don't know what was the catalyst, but I was on a plane, my hand was on my cheekbone, and I felt my face inflating, and the filler that I had on my face turned rock hard.
Oh, wow.
And then I will show you a picture. When I got to back to Dallas, I could not believe what I looked like. Like, my face was, one side was way bigger than the other. It was lopsided. It was, my cheeks where the filler was huge. So some kind of reaction happened.
Oh, wow.
So then I went and got like a steroid to take that down. Then they dissolved the fillers and they put fillers back in. Then they put fillers. It was like a year of like probably getting filler 4 times and dissolving in the same year. I probably traumatized my face so much. And then after that, I was left with this deep line right here that I did not have before the fillers. And I had the loose skin on my jowls. So I'm not even like, oh, I want to look like I looked in 2001.
You just want to be the best version of yourself now.
I want to look like I looked before that that all happened in 3 years ago.
What do you think that could have been, Dr. B?
If it swells up out of nowhere, some people it's because they get a sinus infection or get sick, and then one cheek swells up more on the front. If it's a side cheek, then it could be kind of a strange infection because of filler, usually because the filler was all dumped in one area, like an implant basically. So it's this big ball of gel you have, and then your immune system can't really get to it, and bacteria can grow around it, and then all of a sudden it kind of leaks out of its capsule and causes rapid inflammation. So those are the common in the infection world. Then if your immune system acts up and starts attacking the filler. Again, mainly if you have those kind of big capsules. What was it, on the front of your face or the side?
My cheekbones. And I also finally went, like, I went to several different people in the year. Like, everyone would say, oh, I can fix you. So I went to 4 different injectors. And then finally someone said, you know what, let me give you an ultrasound and see what's going on in your face. And when they did the ultrasound, it was like, the doctor said, it looks like your fillers have migrated. And she was like, let's work on them. So they were moving, they were dragging my face down, and they were making me look older. So I don't know if there's like a little bit left right here. I don't know, but it changed my face, and I hate it because it's like, I feel like I did it to myself. You know what I mean? Like, I don't think
you go through, so those filler, dissolver, steroid combinations can be pretty traumatizing on the skin. And you end up getting, depressions, darkening, kind of different muscle function, different areas. So it's pretty traumatizing when you go through all that.
Dr. B, when you look at people, when you just go out and you meet people and you just look at their face, do you just like sort of like automatically start dissecting their face? Like, what would I do to it, or can you tell when people?
Well, yeah. So the only time I do that is if I don't like their face, and then that's like if they've had bad work done, or if they just look really tired and angry, and I'm just like,
I was at a barbecue at his house, and I had Morpheus, and they melted the fat, and he was so mad. He was like, "Why did you do that?" He was like, "They melted the fat under your chin. I can see it. I can see where they melt." Do you remember that?
Yeah.
You were like,
yeah. So those things bother me. That's when I start staring. Otherwise,
I think Claudia's crazy. I don't think she needs any of that. I mean, but I understand wanting to be the best version of yourself, and I really think like I want to grow old gracefully, but I want to take care of myself to the best of my ability.
I don't want to grow old gracefully.
Right.
I want to look 35 for the rest of my life, okay? Because I was a freak of nature for 40.
Well, you're not Irish, so you're well on your way.
I had 45 good years where I was like, yo, I'm beating the system right now. Like I look way younger than I don't really have pores. Sun, I don't get sun damage. I have some skin tags on my skin. What is skin? Do you recommend lasering off skin tags?
There's different kinds. If they're the kinds that have pedicles, meaning like little roots, you just snip them off, and that's better, especially on your skin tone, so you don't cause pigment around it. And then if they're little tiny ones, you can use something called a KTP laser, and you can like just burn them off without causing too much damage around it. Because your skin type, what happens when you start lasering it, it gets dark around it. So
I had them lasered off, and they came back like years later. Is that from a?
Yeah, it's normal. That's just life. It's not always the same ones that come back. It's like could be a new one.
What does it cause? Like, what causes it?
Skin tags. It could be sometimes from a mutation in the cells of the skin cells. Sometimes it could be from just sun exposure, and then sometimes it's just life. Nothing causes it. They just grow like your normal skin would grow.
I don't want to look like Morgan Freeman or like have a Nestle chocolate crunch bar on my chest, and
No,
I feel like I feel like I'm gonna like look. Shayna, look at them.
You look like you have a beauty mark, like Marilyn Monroe.
It's braille on my chest.
She's crazy. It
is.
You have
Oh my
skin
God.
dysmorphia.
I want to be perfect.
Yeah.
Okay, Dr. B, we're going to ask you about some treatments, and we want you to rate them from 1 to 10 if you think they're good or not.
Okay, yeah, let's go for it.
Okay. Ice rolling every morning. Or ice baths.
Ice rolling. So there's absolutely nothing wrong with it. I give it a rating of like a 6, just because it's not super exciting, but it is a great treatment for somebody who wakes up puffy. And what you do is there's a few types of ice rollers. Usually you're using it for the under eyes. So you have the aluminum ice rollers. You have the aluminum ice rollers. You have the jade ones, which are the green ones. And then you have the pink ones, which is rose quartz. So you can use any of those. And it's fantastic for people with allergies, puffiness in the under eye, any other issue like that. So I do love them. They're not super effective, but they're great. And they fall into the category of like lymphatic drainage massage, which is also fantastic. So maybe I'll give it higher than a 6.
Okay.
Give it a 7.
Wow. I'm surprised by that. Okay. What about tallow balm or beef tallow, beef fat skincare?
Oh.
It's very big on TikTok. The kids are smearing it all over their face.
Really?
Yes. You can make your own beef tallow at home, too.
Oh, my God. That sounds creepy.
Yeah. Not for skincare. You can eat it, and it's fantastic. Great. Make some French fries with it. For skincare, it likely doesn't have too much of a benefit, and you may end up clogging pores, which is an issue that you have with people with oily skin sometimes. So
okay, how about chin straps? Sleeping in the chin straps and jawline bandages.
That's like a solid 2. It's like doesn't really do anything.
Okay,
It's like a chin trainer? Is that what it is?
Yeah, like those.
Oh, Lord.
Those girls, some of them, it's crazy. How about slugging with Vaseline? So the girls, they do their whole skincare regime. They do the cleanser, the toner, the everything, and then they they put a big old thing of Vaseline on to lock it in.
Okay.
So Vaseline
I mean,
slugging.
the boys use it at night too, but it's for a different reason.
They sure do.
Yeah, I
boys.
would say that's almost a 0 in the scale of 1 to 10. So there's no
Okay.
benefit to it. And you're clogging up your pores. I wouldn't do that.
Okay, red light therapy masks.
So, let's say we're talking about real infrared. It's a 8. I love infrared, but infrared generally doesn't exist. You're getting actual red light and orange light. So in that case, I'll give it like a 5, which is a solid neutral, because it could be slightly anti-inflammatory, could make your skin glow a little bit. Doesn't do too much other than that, but yeah, it's not too bad. And there's blue light and green light, which have not been proven to do anything. So it's really the infrared that's the best, but the best most people can get is just red, not infrared.
A friend of mine bought me one of those face masks, and I haven't opened it yet. I didn't know if it was like
I
this.
have one. I just forget to use it all the time. It just sits by my bed.
Mm.
I forget to use it all the time.
It's like a Jason mask. a
Yeah.
little bit. Okay, what about face taping overnight?
Like
That's an absolute 0.
Okay.
Okay, all right, we'll move
Wow.
on.
I was surprised.
Yeah,
at that.
well, and you're going to get an adhesive allergy at some point if you're putting it on the front of the face. And if you do what most people do, they put it on the back. They end up getting hair loss because they keep pulling on the hair with the tape.
Oh, yeah, that makes sense.
Wow.
Okay. Under eye filler.
Under eye filler is a 7 when done properly. It's a 1 when it sucks. So I love doing under eye filler. It can cause a lot of problems, so you have to be aware of that. You have to monitor it over the years because it can change. But it's fantastic when you put a tiny bit. It lasts almost forever. So it's not like something that you have to
Wow.
keep re-upping.
Wow.
So
Really?
you just do it once, let it ride. Yeah. So under eye filler is great. Under eye fat is way better because it doesn't clog lymphatics. It doesn't, cause drainage issues and all that.
I'm
But
coming in for
I like
that.
under eye.
All right, what about
And the only under eye filler you're putting is Restylane L. So you're not putting any other brand in there.
Restylane L? Okay. Baby Botox, micro Botox.
I love micro Botox, so give that one like a 8. It doesn't do I give it a 7 because it doesn't do tons of crazy stuff. So micro Botox was like a term that became popular from this guy Waffles Wu, which is like the best name you'll ever hear in your life, and it's used either superficially in the neck just to relax the connections towards the skin, which there really aren't any, but it kind of works like that. And then the other is to actually stop sweating. So you can put it in the skin, on the forehead, and the hands, and the armpits,
yeah.
and you can use it to stop sweating.
We kind of already asked you about the face rolling, but how do you say that?
It's the PRP,
so
vampire
next, let's skip that
facials.
one. Okay.
Oh, yeah. So I love PRP microneedling. So as far as maintenance goes, it's like a solid 9.
Really?
It's just proper. Yeah, it doesn't do a ton, but what it does is it keeps your skin hydrated, and you use it as a facial every 3-4 months. Now, you don't want to do the classic. So the classic vampire facial was they would actually take you, and there's a couple, social media influencer TV people that had made it popular. I won't say who, but they used the vampire facial with pure blood, like a vampire. So they didn't take the red cells out of it. And what happens is you cause tons of inflammation and irritation in the skin. But when you use it just as PRP, then it's just fantastic. So you take the red cells out of it, spin it down.
They spin the blood and make
And
the
you
liquid
get
gold.
platelet-rich plasma.
Plasma.
Yeah,
Okay.
which is
And I
just,
think
it's really nice. And
what
you could use it for hair loss and a bunch of other things.
Hair loss? Okay.
we're pronouncing
it
this
slows down hair
wrong.
loss.
I'm pronouncing this wrong, but it's called like a gua sha. It's like a tool that
Yeah.
they use on their face, like to help sculpt.
Yeah,
They-
Gouache?
Yeah,
I
so
think.
that falls in the same category as those
Gouache.
rollers.
Gouache?
So you're trying to do stimulate lymphatic drainage, but they're a little more aggressive. So it also will give you a little bit of hydration in the skin by stimulation. So imagine you have a little puffiness in your face, and you drain it out with your hands by massaging it. That's lymphatic drainage, just like the rollers. But then you do it more aggressively, like you're slapping yourself really hard in the face. And this is no joke. It's a Chinese technique where you can go slap yourself in the face a bunch and your face might get a little red and puffy, but then because of that stimulation, it looks more hydrated. So
I'm slapping myself right now. Is it working, Shanna?
yeah. So I don't love it or hate it.
feel so youthful.
I prefer the
Oh, I closed it up by accident.
Oh shoot, sorry. Yep.
Okay, where are we going?
Oh, I have a question. What about castor oil in the belly button overnight?
in the belly button. It would help if you're somebody who has a lot of debris that forms in there for those deep innies. So that's what it's for. Castor oil is one of the more benign ones that you don't worry about getting into body cavities. So it's fine, but that's kind of what it's for. Some people use it in the ear if you form a lot of firm earwax to soften it up, and they mix it with peroxide to get the wax out of there.
Wow.
Okay. Skin cycling, retinol nights, recovery nights.
How do you rate that 1 to 10? The skin cycling with the retinol and the other thing you mentioned.
Yeah. So that's the retinol that we're talking about the whole time. So the retinol, they're great. You want to use it every like 3-4 days. Don't use it too often. If you use it really often, your skin's gonna be dry all the time and peeling all the time. And every time you touch it, you're just like a peeling snake.
So you think like 2 to 3 times a week?
Twice a week.
Twice a week. Okay, and you give that like what, like a 10?
That's a solid 8. It's pretty high up there.
Okay.
It's pretty high up there. But again, you're above 40s. You've got some wrinkles in your skin already. It's not preventative. This is treatment. It's intervention. It's not preventative.
Okay.
Okay.
Microneedling at home.
So I'm iffy on this one.
Okay.
So I love it. I like it. Let's say you're the perfect person, knows how to do it without causing an infection and whatever. Fine. Problem is most people overdo it and they don't have clean needles or have clean skin, and you end up with all these other issues. So I'd say in general, it's a 1 or a 2 unless I specifically told you to do it. So I would say stay away from that.
Microneedling, stay away from it?
At home.
Doing
at
it
home.
yourself, yeah.
Oh,
unless you're really well.
How do you feel
Unless
about
you're really well-
microneedling in general, though? Because people swear by that.
I love it.
Yeah? Okay.
Yeah, I love microneedling with PRP. Now, it's not forming much collagen or doing much in terms of that. What it is good for is, let's say you have some scars, it can physically manipulate the scar to remodel and soften, which is fantastic.
Wow.
And then what else it does is stimulates the area to bring in your immune system. So it helps, again, if you mix it with PRP and you do it for hair loss or you do it for skin quality as a facial a couple times a year.
Wow.
All right. This is something I actually do. Collagen supplements or powders, like those collagen drinks.
Like,
Well, yeah, those are pure stupidity. So that's
What?
that's a
Really?
0.
I've had results.
Yeah.
People were like, what are you doing? I'm like, I just take a capful of this liquid collagen every day.
Yeah, like
Amino
spoiled
scope,
child. I've been drinking that stuff like an animal. It does nothing.
Yeah. Am I wasting my money and time?
So here's the way to look at it. You could buy $1,000 cream, and they tell you that the cream is good because it has a stem cell in it, right? Like apple stem cell or whatever stem cell. But realistically, the active thing in there is the oil that it has in there is fantastic that they use, right? So these collagen supplements are like that. So maybe there's something in there that's good for you that's not the collagen, and that's what's benefiting you. So that's why you may be seeing it, or you're doing something else at the same time, which is helping you coincidentally. What happens when you eat collagen, which collagen is a fiber that exists in your skin and in parts of your soft tissue, it gets digested. So you eat collagen, it gets broken down to nothing. So it doesn't exist anymore once you eat it, right? You're not, So collagen has to form on its own. Your body has to form it.
I feel like you just told me Santa Claus doesn't exist.
I know. I've told like 5 people, and they're all like, "Oh my God, I feel like I look younger since I've been taking it." Like my ex-boyfriend doesn't look as old anymore.
Yeah. So you guys have heard of like vitamin C and scurvy. Remember scurvy?
Yeah.
When the pirates, their gums would bleed.
Yeah.
Right? And their wounds wouldn't heal because they didn't have vitamin C. So vitamin C is one of the vitamin cofactors, meaning it's one of the things involved in cross-linking of collagen when your body's trying to make collagen.
Oh, we need
So
the vitamin C.
Vitamin C is the one that most people have adequate amount if you have a normal diet. But eating collagen does not form collagen
Wow.
because you digest it and break it down into amino acids and
Throw all those
other
things
stuff.
away.
I'm going home. I'm sad now. I felt like that was one of my keys to the fountain of semi-youth.
All right, we'll do like one more, and then we're gonna
right.
We're gonna,
Okay, lasers before injectables.
do you like lasers or injectables? Which either or? Sorry.
Gotcha.
Oh, lasers or injectables? Oh no, you can't pick. But if I had to just do one the rest of my life, well, see, probably injectables. But I did a laser fellowship, so I'm kind of obsessed with laser physics.
Oh,
Okay.
nice.
'Cause I did-
Well, go on.
Jen, I remember I used to do those birthmarks.
Yep.
Yeah, so I did a whole laser fellowship. So I love lasers. I love toys.
Yep. Well,
Thank you for
this has been.
You broke my heart a little bit at
we're
the
still
end,
we're
though.
still like reeling from the collagen.
I know. I swear by it. Wow.
Oh my god! Well, I can
Yeah,
stop
well,
that
there might be
subscription.
something else good in there. Those are like multivitamins, so it might be something else in there that you like.
It says amino sculpt, like amino acids. But maybe that's what it is.
I mean, if you're somebody who lives in Sudan and you're starving of protein, yeah, it's fantastic. But
Damn it.
otherwise, you probably have methods too.
Well, Dr. B, what is the one thing that there's going to be a lot of women and there's men listening, but what's one thing that you want women out there to know before we kind of wrap this up here? What's your one beauty advice, since you work with all the celebrities and, you are one of the leading surgeons in this industry?
I would say so. Prevention is overdone. It's really, really overdone. Everybody wants to prevent. Most of this stuff is genetic. It's going to happen anyways. So, do things only as needed when needed.
Mm-hmm.
That's my main advice. So you don't end up on this road of regret where you did something that aged you faster, right? We don't live in the multiverse like Spider-Man where you've got two different parallel lives to compare what would have happened if you did something or didn't do something.
Mm-hmm.
So I'd say just do things as you need. Most of this stuff is genetically determined. It's going to happen anyways. And then, learn your body, see what works for you. There's no magic potion to everything. So, learn your body, see what's good.
Awesome. Well, I know we are just so grateful for your time and your energy today and for teaching us so much. Dr. Ben has Cupid Lips over on Sunset Boulevard in Los Angeles. He's the founder. They do all kinds of, they have trained wonderful technicians there. Dr. B, where can our audience find you?
So I'm on Instagram at Dr. Ben Talei. So just DRBEN and I'll pop up. And then we got Cupid Lips of Beverly Hills, which is also on Instagram. And that's that lip and non-invasive. So we do everything non-invasive. All that filler, Botox, laser stuff we're talking about, that's where you go.
Awesome.
And we're opening one up in Newport and then Scottsdale and then Dallas and then Miami.
I'm coming to see you. I need you to look at this face.
Oh my gosh, she is
need
crazy.
you to
She's so beautiful.
No, I used to be 3 years
Oh
ago.
my God.
I don't mind looking at supermodels up close. You're welcome to come.
But we are so grateful to have your time and energy and know you're a
Yes.
very, very busy man. He's booked up like 3 years in advance. He's
Damn it.
incredible.
I'm going to look so old in 3 years.
We're going to squeeze us in. But again, thank you so much. Have a fantastic day and appreciate you. Love you.
Thank you so
again,
much.
Thank you.
My pleasure. Thanks for having me with you two.
All right. Take care. Bye.
Bye, Dr. B.
Bye.
Well, I just wanted to apologize and let our audience know that I will be working on that. I can't make any promises, but I did want to say I think that we're all like our biggest critic, right? Like we all have a vision of how we see ourselves or want to see ourselves. And I think if we just continue to try to be the best version of ourselves, at any age, I think that's really the goal. And so whether plastic surgery, this is just like my kind of like PSA out there, whether plastic surgery is for you or it's not for you, always listen to your heart, always listen to your gut. And if, I don't judge anybody. If someone wants to do it, great. If someone's like, hey, I'm going to embrace like Pam Anderson, awesome. I celebrate that too. I think it's a personal choice.
I'm not embracing shit. I snatched this face all the way back. Okay. Thank you so much for watching the Wicked Awesome podcast. Make sure you tell a friend to tell a friend. And don't just listen to us. Please download us.
Yes. Listen, share, like, and we would love it if you gave us a review. That would be so awesome. So thanks, guys. For hanging.
Bye.